I practice here in Allentown, Pennsylvania, as part of the greater Lehigh Valley, as we call it up here. I'm trained as a surgeon as well as a surgical intensivist. That's my background, as well as a surgical subspecialty. And over the years have developed an interest in occupational medicine, utilization review work. I am the medical director for a health camp in the rural part of the state where we provide health care to workers that are working on the pipeline and gas shale and oil shale businesses in the state of Pennsylvania. And I sort of run a concierge medical practice of more of a consultant nature here in Allentown as well. So my background's kind of varied, and I'm always sort of exploring new ideas and new frontiers, and it's sort of how I think eventually I gravitated to the idea and the concept of telemedicine, which I think is the next growth area or budding area in delivery of healthcare here, at least in North America, but probably even outside of North America. Somewhere in the last 10 years or so, as I was transitioning out as a full-time surgeon in surgical practice, I developed a profound interest in the concept of telemedicine and in the potential delivery of telemedicine. My demographic, my age group, comprises a third of all practicing physicians. The number of practicing physicians we have are inadequate to meet the needs of our healthcare demands. And the demographic that I'm in is the one that is probably seeking exit from healthcare at a much earlier age than our predecessors did. They'd all worked well until their late 60s and 70s, or as old, or as what age that they could work till. And what I'm seeing among our demographic is that the ability to do that does not appear, or the same interest does not appear to be the case. So with that in mind, with the national shortage of physicians to begin with, even if you accepted this demographic away from, or even had them as a full participant in the healthcare consortium, our healthcare delivery ability for our needs are going to diminish rather dramatically over the next 2 decades at a minimum. And the only way that we can at least address the problem in the short term are the use of physician extenders, nurse practitioners, and physician's assistants, or the area of telemedicine, which is to reach more people in a easier and more fastidious fashion. And the telemedicine concept was one that once I sort of became interested in it, I sort of became imbued with the concept as well. And because, as I say, that's where the delivery of healthcare is going to have one of the most profound effects. And I don't think that as a nation, or as a nation of healthcare providers that we are part of, our group of healthcare providers that we're part of, I don't think that we're fully cognizant of the power of telemedicine. A lot of people sort of regard it as a very small aspect of care, or a gimmick, or one more entrepreneurial aspect, and to sort of continue or dovetail to how did I get to Consultadoc, is that I looked at a bunch of these telemedicine concerns, and Consultadoc, it was, I don't want to say an answer to my dreams, because it's probably a little excessive prose, but it did in the standpoint of what it does and what the level of practice of medicine, I think the standard needs to be. And I think they, at this point, have set the standard and met all of my issues, possible concerns, and the delivery of health care has been beyond excellent. It has exceeded my expectations in ways that I really did not expect. I mean, I knew that the company was an excellent one. The people that I dealt with in joining were all professional. Everything they said that they would do, they did, and then more so. And then the centralization, the organization, the ability to have physicians interface with patients has been astounding to me. ConsultAdoc, why I became interested, they're the largest concern. They're in all 50 states. They're all board-certified physicians that are participating. We're probably approaching 250,000 patient consultations or patient encounters, and just my only regret is that I don't have a chance to do more of it. I mean, I love everything that I do, and they have enough physicians, and they're separated and cordoned in states, and if I had more shifts and more opportunity to converse with patients or talk with them, I would welcome that. Probably 5 hours a week, give or take, would probably be the case in terms of active interaction with patients. The beauty of ConsultAdoc is that one's sort of free to incorporate that within the confines of their practice, so that one is mobile, one can be in different places, one can still answer the consults, even if they're what we call formal consults via use of the online effect, or sometimes when we field telephone calls from patients with respective problems, that makes one even more mobile. But between the iPad and the PC and the laptop, I'm as mobile as I need to be, and able to meet all the needs of what ConsultAdoc expects of us, as well as the needs of the patients. And sometimes it requires a little creativity, but it's really worked out very well. This is the area that's really surprised me. I don't want to say the bread and butter, because that's not really fair, but a percentage of the patients that call usually have sore throats and colds and likely need some antibiotic coverage. It's not always a given, but that is a part of it. But the other part of it is when you're on call for a shift, there are a lot of patient calls that come in that you field. And I've been amazed at both the breadth of the calls and the complexity of some of the issues that have come through, which really surprised me, and where I'm allowed to render an opinion, not necessarily a diagnosis, but clearly, as I say, every day it's another story. I got a call yesterday from actually the case, the mid-afternoon, late afternoon yesterday, from a lady in Mississippi who likely had a spider bite. And she had been to the emergency room the day before, and they said, oh, it's just a little ingrown hair or folliculitis. And they put her on some antibiotics, but it was getting worse. Now, most individuals, if they didn't solicit a different opinion, they'd go, okay, I'm on antibiotics, the doctor said that's fine, and they didn't think it was a spider bite. And I said, describe it to me, and it sounded classically like a spider bite with central necrosis and so on and so forth. And I said, you need to go back to the emergency room ASAP and have them reevaluate this, because it, as I say, I couldn't be 100% sure that's what I was dealing with. But my fear is, or my creed on medicine is not to be right, but to do what's right and safest for the patient. And so I think that issue resolved appropriately. I got a call one evening from a father in Texas who had a 13-year-old son who sounded like he had classic appendicitis. The father didn't want to take the son to to the emergency room. It was late. It was like 9 or 10 o'clock at night, and it was a school night, so on and so forth. So we're talking. I'm asking him questions, and finally puts his son on the telephone, and his son had every classic sign and symptom that you would expect from that. And I said, look, I can't, again, I'm not allowed to render a diagnosis. I'm only allowed to render an opinion in that setting. And I said, look, this is what I think, and I think that the safest thing to do would be to take him and have him evaluated. If it's nothing, you're home and done with, and you don't have to think about it further. Other areas that I found have been underserved for college students. I've got a number of calls from college students and I think this is a demographic that probably needs to be reached out to and incorporated more into this practice, because they receive poorest care. They're the most that are susceptible to all sorts of infections and illnesses. And I've noted on a couple of occasions that I had to spend a lot of time on the phone with them, more time than I usually do, but I was glad to, because it was very, very engaging, and the students are very engaging. They listen, and they had some real healthcare concerns that needed to be addressed, and I was a little awestruck by that. I thought that was really reaching a group or a demographic that we rarely get to until they're really sick in advance, or they end up in a hospital or some sort of situation like that. No, absolutely not. There would have. I mean, when I was a medical student, the computer sort of was there, and it was about 1/100th of contributed to our medical care. And even in the decade of the 80s, which served for the bulk of my training, it was just not part of the mainstream. And so that part of medicine, we'll say up until the early 1990s, really reflected the century. But since that time, you could see this was starting to build, and the website, WebMD, and Medscape, and all of these entities sort of came into being. And although they were crude somewhat in the beginning, they have absolutely refined themselves. And then, as I say, the next step was offering computer-based medicine, and I don't know, either I was ready for it in terms of the whole gestalt and where healthcare was going, or my computer skills had kind of reached a point, kind of caught up to the mainstream where I could see the utility of it. But it had led me to at least understand and recognize that I saw that as the future then, and I still see that as the future and front line as we go forward, as we try and sort through the maze that is healthcare, from whether Obamacare stays or whether Obamacare is repealed. It doesn't really matter. The whole discussion, or the cat is literally out of the box now, and that right-minded people are beginning to question all aspects of healthcare, looking at all aspects of healthcare, and at least, if we're, say, a nation of 50 individual experiments, that the telemedicine is sort of, we'll say, flown under the radar somewhat, and it's allowed a company like Computerbased to refine its business plan, integrate it, sign up the physicians, and really be able to deliver healthcare in a safe and effective manner. And as I say, my only regret right now is, let me do more. I really, really enjoy it.